It's incredibly exciting to have won this programme of work with our partners at Autism, because our strategy here at the Anna Freud is all about trying to close the gaps that exist in mental health provision for young people, children and families. And being able to deliver this Train the Trainer programme means that we'll be able to close the gaps in people's skills and knowledge of working with autistic people, and hopefully, ultimately, be able to change people's experience of care and of the services that they access in turn.
We're delighted to be working in collaboration with the Anna Freud Centre on this innovative national programme. This course will be of benefit to people working in all areas of mental health: child wellbeing practitioners, social workers, nurses working in CAMS, staff working in inpatient care for children, adolescents and adults, as well as education staff in residential schools and in youth justice sectors. A key aim of this training is to support you in improving the effectiveness of your service for caring for autistic people. You'll be able to attend talks and group exercises run by national experts, including clinical tutors, academics and autistic people, some of whom are academics, and their family members. Key learning outcomes include examining the communication differences between autistic and non-autistic people, challenging the stereotypes of autism, understanding autistic burnout, meltdowns, shutdowns, and masking, understanding trauma, anxiety, or depression in autistic people, measuring outcomes and using collaborative therapy behaviours, and identifying ways that your service might improve autistic participation.
Anna Freud Centre and AT-Autism are committed to creating lasting impact within services by changing mindsets. Autism is not a disease, and autistic people should live happy, healthy lives in their communities. Appropriate training, co-designed and co-delivered with autistic people, is essential so that autistic people across all ages can receive appropriate person-centered care, whether in hospital, residential settings or in their community. This will ensure that all delegates have an opportunity to engage with and amplify autistic narratives, reframing negative or limiting perceptions of the autistic community. Our approach is trauma-informed, which means that we recognize the presence of trauma symptoms and we acknowledge the role of trauma on an individual's life, including service staff. Our experience-sensitive theoretical framework is drawing together 8 dimensions of human experience that can be key to autistic people's well-being, such as agency, uniqueness, sense-making, personal journey, and togetherness. We're placing the views of autistic people at the center of their own life world to acknowledge and validate them as experts of their own lives. Developing empathy for the experience of others is a key objective of our training. We will equip trainees with an understanding of how their own beliefs, values and behaviours may have an impact on people they are working with.
One of the most exciting aspects of our programme are the communities of practice that will be running throughout the programme, led by our dedicated Community of Practice lead, Chris Atkins. These will focus on identifying, discussing, supporting and disseminating core principles and best practices that promote autism understanding and acceptance.
Also, in terms of closing the gap at the Anna Freud Centre, we're not just interested in training for the sake of training. We really want to know how that training makes a difference on the ground for autistic people and also for the professionals working with autistic people. As part of the evaluation process, we're going to be using a tool called POD, which stands for People's Outcome Data. It's a piece of software that we developed at the Anna Freud Centre with UCL partners, University College London, and it scores evaluation data in real time. So we'll be able to understand the impact of the training. So the whole purpose of this iterative evaluation process is to ensure that the training we deliver improves the skills and knowledge of the professionals being trained up, and most importantly, in turn, improves the experience of care for autistic people.
We welcome a diverse group of trainers who share our ethos, passion and commitment to improving support for autistic people in healthcare settings.
I'm very excited to be working with our colleagues from AT-Autism to deliver training across the next 3 years for all ages community settings, inpatient mental health services, youth justice, and residential schools. You will find details of how to book the training on our website, and I look forward to welcoming everyone onto this training that will significantly and hopefully permanently better care for autistic people across all ages mental health settings.